color Doppler and 3D ultrasound for assessment of infertility, the sonographic monitoring for ovarian cycle, in which we look for follicular size and its growth. We perform color Doppler ultrasound for perifollicular blood flow. We look for endometrial thickness and measure its thickness, and we look for the echogenicity of the endometrium. And the last thing which we monitor is subendometrial blood flow. If you look at this scan, here we have a follicle which is 13 into 14 millimeters, and by putting color Dopplers we can get the color flow, and here is the spectrum of this vessel which is showing flow in it. This is another follicle which is a bit larger than the other one. It is 17 into 16 millimeters, a mature follicle, and the vessel is there, and we will perform spectral Doppler to assess its RI and PI. For perifollicular blood flow, if the resistive index is 0.50 to 0.55, hemodynamic parameters of follicular growth are assessed. Then it's the RI, which is 0.42 to 0.48. There will be significant reduction of vascular resistance in the periovulatory phase. Here is periovulatory follicle, and you can see the two follicles, and here is the flow of the feeding vessel. This is perifollicular flow, and we can measure the resistive index. In this case it is 0.49. So 0.49 will be falling in this criteria. So it means there is significant reduction of vascular resistance in the periovulatory phase. Identification of the follicle containing high quality oocytes, high probability of recuperating, fertilizing, cleaving, and implanting. So, an important thing is the collection rate of the follicles, embryo development, and implantation rates, while we assess peak systolic velocity when it is above 10 centimeters per second. So we measure perifollicular flow and assess the peak systolic velocity and resistive index. This is without induction, and here it is with FSH, follicle stimulating hormone induction. Multiple mature follicles are seen. This is without induction, the normal follicles in a normal cycle, which is not a stimulated cycle, and we can find the flow here. So once we get the follicles, we will look for the flow in the follicles, its vascularity, and endometrium, and we will try to choose the best follicle having maximum flow, means the least resistance around it, for implantation. This is cumulus forus, and you can see the follicles here on 3D. The higher quality oocytes, there will be higher fertilization and implantation rates if there is more flow. So oocytes obtained from high vascularized follicles, these are the follicles. So we will choose the highest highly vascularized follicle from the available set of follicles depending on the perifollicular vascularity. The stages of the corpus luteum, the first is organization and vascularization. Resistive index will be 0.43 plus minus 0.04.